Hey everybody, it's Mrs. Benson. I am going to do a Field Focus Friday PowerPoint for you on occupational therapy. I want to tell you all about what I do when I'm not teaching you and how much I really enjoy it, and maybe some of you will enjoy the profession as well. All right, so first of all, what is an occupational therapist? So you can define it technically. Occupational therapists and occupational therapy assistants help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities or occupations. So we're trying to get you back to whatever it is that you want and need to do, the things you love to do every single day. We're trying to get you back to where you were before maybe an accident or something occurred in your life that is impeding you from doing those things. So typically working with children with disabilities, that's the area that I've worked the most, helping people regain skills after an injury. So you might do more of an acute care, long-term care, or older adults regaining function of loss of skills. So it could be a physical loss or a cognitive loss. So services themselves, they look like this. You're going to do an evaluation. You usually do some type of standardized test. Um, the test listed there, like the Peabody, Battelle, visual motor skills. You have to use observation as well as a standardized test. You might work with the caregivers. They might have more insight into the patient you're working with. Client report, so talking to the clients themselves. Maybe it's an older child or an older adult. And then your written report that you will write up and submit to insurance for approval. Some people don't have insurance, so sometimes you can do private pay. It just depends on the facility. It's very client focused, the intervention, knowing clients' goals and helping them reach them. So specifically, I've worked in early intervention. You go into the home, you work with the family, you ask the parents, like, what is it that you want to see your child achieving? You know, was that walking? Maybe they're having difficulty eating, speaking. So you really try to gear it towards the client and their family and do what they need and want. Your duration of visits for OT is usually 45 minutes to an hour. We bill in units. Usually every 15 minutes is a billing unit, or it goes from 7 to 15 depending on the time. So usually you'll bill for three or four units when you're done with your therapy services. You're going to do that comprehensive eval. That's where you write up what you saw on the physical eval that you went and did with the family, the child, the client of any kind. And then you write out what those goals are that you want that person to achieve. And that's what you work towards during your therapy sessions. Okay, this is one of my favorite slides just because it gives you such a fun overview of what OT really is, and it's really fun. So you can see here in the upper left-hand corner, there's a girl on a therapy ball working on some fine motor skills. So she's probably also working on gross motor, core strength, maybe some visual motor, eye-hand coordination while she's trying to put the pegs in. She probably has lower tone meaning that she has a hard time like maintaining her posture, walking, sitting, those types of things. And you can see the therapist there supporting her and helping her. I work with kids a lot. This child is a little bit older. Typically you might see anyone from birth to, you know, pre-teenage, maybe doing something like this. But a lot of times kids birth to 3 that I've worked with, we will do a lot of therapy ball activities, and it's a lot of fun for the kids. The picture below that, you see a hand therapist. So she's working with the gentleman who probably hurt his wrist or his hand of some kind. So there you're working on the muscles, bones, tendons of the hand. You're doing a lot of like therapy and therapeutic modalities, like maybe you're doing heat, cold stretches, exercises, and you just concentrate on like the upper extremity as a hand therapist. Middle upper picture, the older gentleman doing the TheraBand with the therapist. So you might be in long-term care, just helping someone get stronger and build that muscle strength to get back home. The picture below, you're helping a gentleman learn to walk. So you might be thinking, well, isn't that what physical therapy does? And sometimes you in physical therapy may be doing similar activities, but for different reasons. So as an OT, my goal is for you to be able to walk so that you can get to the bathroom, or that you can get into the shower or stand in the kitchen and make a meal. PT is looking probably more for you, can you walk the length of the hallway? and back, and how long is your endurance. I want you to be able to walk to do an actual skill. The picture below that, again, you're seeing a little girl. She's stacking blocks, and she's probably working on some standing balance, again, core strength, eye-hand coordination, visual motor skills, being able to stack those blocks. As a kid, it really looks like play when you're a therapist, because that's what kids' main job is to play and to learn those skills so that they can build on them, so they can go to school, sit in a chair, write, play outside with their friends, all of those things. The top picture with the lady cutting an apple, she maybe, we can just say, has had a stroke or some other reason that maybe she has weakness in her upper extremity. She's using some adaptive equipment. So a lot of times therapists will help families, clients find equipment that they can use so they can still do those tasks on their own independently. So this knife would help her to not have as much strength in her hand to have to push down to cut that apple. It gives her a better way to grasp onto it, a nice big handle. So adaptive equipment is very important as an occupational therapist. And then the bottom final picture, it's of a little guy in the water. Water therapy is really important for a lot of kids, even adults. It takes away that gravity and gives you a lot of movement. So you're able to swim and move those muscles and work on strengthening that way, and swimming's always fun. So this is just kind of in a nutshell some really fun things that therapists get to do. There's a lot more that isn't on this page, but I love just seeing all the things that you can do and work on with different age of clients. So what kind of training do you need to be an occupational therapist? Um, Obviously you have to graduate from high school. You guys are already doing the right things. You're taking the classes that you need to take, health careers, your sciences, your maths. You want to get exposed to these things, guys. It's really important to know where you want to go and what you want to do, and we hope that you love something in the healthcare field so that you can stay with us. And so this class and your medical terminology classes and the other classes will be really important. Once you graduate from high school, you're going to go on to college. You need a 4-year degree. It doesn't necessarily have to be, you don't go into OT for a 4-year degree. OT, you have to have a master's degree, and they're really pushing for you to have a PhD, actually. So you get a 4-year degree, and then you usually go into a master's or doctorate program to receive your OT certification and licensing. For example, my 4-year degree is in nursing, as you guys know, and then I went and got my master's degree in OT. I do know that UND had, for a long time, I'd have to look back now, a master's program that you could complete in 5 years. So you do get accepted early, and you get those classes done usually about a year before going for your 4-year and then to your master's. A lot of people that were in my classes in OT school, we had myself, a nurse, so some people come out of nursing or other medical professions. We had a lot of kids that had psychology degrees, maybe some fitness degrees. We had a special education teacher, so it can be a wide variety of people that choose to then turn in their degree into an OT degree. Once you graduate from school, you're not quite done yet. You do have to sit for a board exam, so you have to get licensed in your state, and then you have to pay to have your registration on file with the national agency too, which is the National Board of Certification in OT. The state gives you your OT/L, so that says you're licensed, and then your registration gives you the R. So if you pass all those things, you get to put OTR/L, so you're registered and licensed for occupational therapy. There are lots of professional memberships. We have the North Dakota Occupational Therapy Association. We have AOTA. They help North Dakota Occupational Therapy Association, obviously. They legislate for us at the state level, and AOTA does it at more of a federal level to make sure that our profession has things in place for us to be able to see patients, get the word out there and how important this career is, make sure that other professions don't come in and take, the skills and things that you're doing for their profession as well. So there's a lot of lobbying. They put out a lot of continuing education for therapists so you can continue to build and grow as a therapist. You need to have CPR and first aid always. And you're always going to do additional training hours. So you're never going to stop learning. It's obviously not like you're sitting in class, but you might have to do a little online course or some self-studies on your own. And that just keeps you up to date. And you do those 20 hours every 2 years to renew your license. You submit them to your state board, and then they will send you a new license. So where do occupational therapists work? A majority of occupational therapists work in offices, clinics, or hospitals. So most of my experience has been in an office or a clinic in town, usually a private company, or I have done some long-term care, acute care in a hospital during my schooling rotations. In the hospital, you might be working in a stroke unit, spinal cord, more of that specialty hospital like we've talked about, ortho, hand therapy, pediatrics, or acute care. Other places you can work is schools. We do have OTs at the schools. We even have one here at Cheyenne that will come and see some of our students. They have them in the elementary schools a lot of the time because at that point you're still really trying to get those kids to have those fine motor skills to do a lot of tasks that you need as you get older. Nursing homes, home health services are becoming more and more popular all the time as we're trying to get more people to stay in their home versus to be in a facility. Mental health facilities also have OTs, your community health, insurance companies where you read the insurance plans that therapists working with the patients write. And then you sometimes can work for businesses where they want you to do ergonomic plans for their staff so that they don't get hurt. All right, so just to continue with the information about salary, again, just to reiterate, OTs in 2019 were making about $84,000, about $40.84 a year. Again, it'll depend on where you live. In our Midwest area, I would say an OT probably makes anywhere from $60,000 to $75,000. If you've been working for a long time, you're probably at the top end, maybe closer to the $84,000 and $40 an hour, but it really will depend on your years of experience in the setting that you work in. The job is still growing. It's growing about 16% each year. It's much faster than average jobs. Next slide, you can see on here the job comparison. So an occupational therapist, again, was around $80-some thousand, maybe a little bit less than a physical therapist, but definitely more than an OT assistant. An OT assistant has about a 2-year degree. There's some things that they are not allowed to do in the profession that OTRs are. Registered nurses are making maybe a little bit more, or a little bit less, excuse me, and then you're making more than like a paramedic or a massage therapist. You can see there, if you look up the top 100 jobs right now, we are number 8 on the best jobs reports. That's still really good, and if you look at the list, pretty much the top 20 to 30 jobs, a lot of them are healthcare related jobs. It is a really good job, a really good profession, and you can make a really good living too. The projected growth, this is the old one again, the last slide said 16%, before it was at 24%. So I think part of it has to do just with our economy and how things have been, and that just goes across the board for all jobs. So what does an OT do? These are some videos that I'd like you to like copy and paste and watch. Just get a little bit more information about what an OT does. I really enjoy this pediatric video here. So I'd love to see you guys open that up and take a look at it. I think that it really talks about what an OT, especially a pediatric OT does, which is what my focus has been in most of my career. I really hope that some of you are interested in OT and that you will explore it further. And if you have any questions, so please come and talk to me and ask me at any time. And I hope throughout the course of this semester with one of these professions, something maybe sparks an interest in you and you can research it a little bit further or talk to any of us teachers and we'll help you. All right, thanks guys.